Hey Duluth, today we're going to address the fourth in our series of big issues, downtown. You know, downtowns are the heart of a community, and like your body, when your heart is not doing well, extremities will also decay. Whether reality or perception, an experience you've had directly or just one you've heard about, too many right now do not see downtown Duluth as attractive, clean, or safe. We need people living downtown to help ease our housing inventory crisis. We also need individuals dealing with mental health issues who currently have no good place to go to have safe and clean opportunities for long-term care. Jail and ER beds are the current solution. Neither are effective, nor are they affordable. What's the result? Tent encampments or living on the streets. So what are tangible action steps the next mayor and administration can take? Let's start with downtown residential. Again, we need people living downtown. Nationally, post-pandemic, we have 50% excess downtown commercial space. That means we also have 50% more opportunity for downtown residential housing. To get downtown urban housing, we need to address zoning and inspection issues that make it difficult for commercial, retail, and residential to exist within the same structure. That will help us address the significant number of existing single-family homes being taken up by solo individuals or couples. These solo individuals and couples who do not want to rent and cannot find another lifestyle housing option downtown. Downtown residential also gets us coffee shops, bookstores, grocery, restaurants. It also gets us more eyes on things. But again, to get people returning downtown, we first need downtown to be attractive, clean, and safe. Now there are some long-term solutions we can take. If we were to go back in time, we would not dismantle the state regional treatment system in favor of community-based care. This has left a deficit of long-term care resources in Minnesota and a drastic shortage of mental health beds. So another legislative priority of mine in 2024 will be working with the state for an investment, a significant increase in regional mental health facilities and beds. Locally, we also need to focus on supportive housing options like the San Marco. This has been incredibly effective for those struggling with alcoholism. It's supportive care for those who can't kick their addiction, and also recovery options for those who are able to give it a try. This can be a city, county, state partnership model that we go after while the state works on rebuilding the regional treatment system. And in the meantime, there are absolutely short-term solutions. First, let's implement a public awareness campaign. This includes signs and ads, things that encourage well-intended donations to organizations, but discourage giving to panhandlers. We can also look at local ordinances that align with the Supreme Court decision that ensure individuals in public safety and also free speech. Yes, panhandling is free speech, but time and location can still be regulated. We must also support our police in enforcing laws and ordinances. Panhandling may not be a crime, but vandalism, graffiti, drug use, drug sales, public intoxication, urination, defecation, those things still are. Collectively, we have also all accepted what seems to be a new norm over the past couple of years, and that's not helping. Instead, our community mantra should be not this behavior in this place. When we choose to live in community, we have community norms, and those norms need to be enforced by our law keepers and by us as residents. Again, jail is not effective or the affordable option. So let's continue close coordination with our local organizations that provide crisis supportive services. Duluth, we can do this. We want downtown to be vibrant. We want downtown to be thriving. We want people living downtown. Let's partner together to take the steps necessary to make that happen and to care for the individuals in our community who also need help and support. Thank you.